Welcome dear doctors, welcome to the class of Pediatrics Kids Covery. I am Dr. Parv Luthra and we are going to discuss today about the Lipidoses. So broader domain we are discussing about the inborn errors of metabolism, and in the inborn errors of metabolism we are discussing about the Lipidoses. This is our fourth class. So what is Lipidoses, my dear friends? Lipidoses is a condition where you will see a lot of lipids which are getting accumulated, a lot of lipids. Okay, so yeah, this is called as lipidosis. In the last class, if you remember, we discussed about familial causes of increase in lipids, but now we are going to discuss, of course the diseases are going to be familial only, genetic only, but there is not hyperlipidemia, it is lipidosis. Now what is the difference? Let me just clear it with you. Hyperlipidemia, that means the lipid is increased in the blood, whereas lipidosis means it is going to get increased but in the cells. Alright, you got it. So these are the 6-7 diseases which are actually very important for you to understand. Now you know from your basic knowledge of biochemistry that there are different types of lipids. So firstly we are going to discuss about the lipids which are sphingolipids. Which are what? Which are sphingolipids. So what are the diseases which are associated with increase in the sphingolipids, and that is called as sphingolipidosis. This is called as what? Sphingolipidosis. Okay, so let's understand about the sphingolipidosis. So first disease is going to be Gaucher's disease. Now Gaucher's disease is due to the deficiency of enzyme glucocerebrosidase. That's why the glucocerebroside is going to get accumulated. Very easy, simple. Alright, so see G for Gaucher, G and U are coming at third place. Similarly here G and U are coming, G is coming, and then at third place you will see U. So Gaucher's disease is because of glucocerebrosidase deficiency. Glucocerebrosidase deficiency. Alright, coming on to Tay-Sachs disease. So Tay-Sachs is just like 6. So because it is 6 is called as hexa. So hexosaminidase A deficiency. So Tay-Sachs, T for Tay, T for 2. So please remember this is GM2 ganglioside accumulation. GM2 ganglioside accumulation, that's going to happen. Coming on to Fabry's disease. So please remember you have got alpha galactosidase that is deficient in Fabry's disease. Alpha galactosidase. In Gaucher it was glucosidase, in Fabry's it is galactosidase. You're getting it? In Fabry's it is galactosidase which is going to get deficient. Alright, so just remember, very simple thing, whenever you will see a word lacto, it is actually related to Fabry's disease. Okay, so coming on to Krabbe's disease. So what is Krabbe's disease? In Krabbe's disease there is beta galactocerebrosidase. Which is the enzyme which is deficient in Krabbe's disease. Okay, so Krabbe's disease, please remember Krabbe is having double B in it, Fabry's is having single B in it. So because there is double B which is coming, so there is beta galactocerebrosidase or beta galactosidase deficiency, whereas in Fabry's only one B is coming, so it is alpha. And yes, alpha galactosidase deficiency is going to be there, of course, because there is in Krabbe's disease, because there is beta galactocerebrosidase deficiency, galactocerebrosides are going to get accumulated. Okay, whereas in Fabry's disease there is triacylceramide that's going to get accumulated, but it's not very important, so you can just leave it. Coming on to Niemann-Pick disease, that is the sphingomyelin. Okay, so sphingomyelin, Niemann-Pick disease. Can you see sphingomyelin is having NIP? So NIP. Okay, so sphingomyelin NAS deficiency in Niemann-Pick disease, of course, leading to sphingomyelin accumulation. Next is the Farber's disease. So Farber's disease is actually not very important, but You can remember farmer, just like farmer, a farmer who has consumed a lot of acid. So acid ceramidase deficiency. Alright, so that's why ceramide is going to get accumulated. Then Sandhoff disease. So Sandhoff is just like hexosaminidase. So I just teach like this, that S for Sandhoff, S for 6 is equal to hexo. So hexosaminidase deficiency. And next comes the metachromatic leukodystrophy. This is important. Metachromatic leukodystrophy is important, where you will have accumulation of aryl sulfatase. Okay, so this you have to remember, and that leads to the accumulation of sulfatides also. So the mnemonic is small. So M and L for M for metachromatic, L for leukodystrophy, A for aryl sulfatase A, and S for, of course, sulfatides, which are going to get accumulated. Okay, so if I just discuss one by one again with you, understand Gaucher's disease. In fact, for that matter, all the diseases of sphingolipidosis are having the autosomal recessive, not Gaucher's. In fact, all these sphingolipidosis are having the autosomal recessive, except a few I'll discuss. Okay, so can you see the deficient enzyme is glucocerebrosidase, the inheritance pattern is autosomal recessive. What are the clinical findings in glucocerebrosidase deficiency? Where you will have the accumulation of glucocerebroside. Glucocerebroside of course has something to relate with glucose, and because it has something to relate with glucose, there will be hepatosplenomegaly which is going to be there. Okay, there is hepatosplenomegaly that's going to be there, and of course the very important thing is Gaucher cell. Okay, Gaucher's cell. What are Gaucher cell? So remember, Gaucher's disease has Gaucher cell, which is a lipid-laden macrophage. There is a macrophage which is having lipid with a crumpled tissue paper appearance. Okay, there is a crumpled tissue paper appearance that's going to be there, and I always teach like this, that C and G look very similar. So what is C and G? C for crumpled paper appearance, G for Gaucher cell. Okay, and Gaucher, can you see the mnemonic Gouch? Ouch. So ouch means there is a bone pain. So there is osteoporosis, especially the vascular necrosis of the femur that's going to be there. Okay, so what you will give? So can you see this is glucocerebrosidase problem. So glucocerase, like that. Okay, so everything is going to have the name glucerase, and yes, this is a very important the image that's going to be there, because there is a flask shaped deformity that's going to be there. Flask, can you see the flask? This is the flask. Okay, this is the flask. So there is a flask shaped deformity which is going to be there, and of course these are the lipid-laden macrophages, with especially if you see this is having a crumpled paper appearance, crumpled tissue paper appearance. Okay, so when the patient is going to say gouch, we have to understand ouch, and if it is ouch, please give them tissue paper to at least clean their tears. Okay, so crumpled paper or tissue paper appearance. Coming on to the Tay-Sachs disease, I have told you already, hexosaminidase deficiency, autosomal recessive. Now Tay-Sachs is important because there is hyperreflexia and cherry red spots on the macula. Why cherry red spots? Because the lipids are going to accumulate in the ganglion, in the retina actually. Lipid is going to accumulate in the ganglion cell layer or in the retina. Okay, and of course there is an onion skin that's going to be there. Of course there is no hepatomegaly, this is going to be seen. Okay, so how to remember all these things? So remember very easily, Tay-Sachs disease, T for Tay-Sachs, T for tiny organs. T for Tay-Sachs disease, T for tiny organs. Okay, tiny organs means there is no hepatosplenomegaly which is going to be there. Okay, and in alphabets S and T are very similar, I mean very close. So what is S? S for startle reflex, my dear friends. Startle reflex. So there will be increased startle reflex, hyperreflexia that's going to be there. and cherry red spot is extremely important. Cherry red spot is important for this. So please remember, just like ST, there is something which is called as CT scan, right? So cherry red spot is seen in what? Tay-Sachs disease, but remember the combination is cherry red spot plus startle reflex is increased plus tiny organs are going to be there. Okay, you got it? Good. But when it comes to cherry, so just remember, cherry is tiny, okay, but big one is going to be onion, okay. So cherry is tiny, but big one is going to be onion. So just like cherry, you can remember onion also. So onion is seen in what? Onion or onion? Onion, okay. So onion is seen in what? Onion is seen in the Tay-Sachs disease only, okay. Onion is seen in the Tay-Sachs disease only, okay. And if you can remember onions, that's going to make it more simple, because 1, 2, 3, 4, 5, 6 letter word that's going to come in the Tay-Sachs. Sachs is also just like 6, okay. So this is the appearance. Coming on to Fabry's disease. So Fabry's, in order to remember Fabry's, just remember as if you are watching some fabric, beautiful fabric, okay. I've got a picture also. So there's a beautiful fabric. Treat me as a shopkeeper who is showing you the fabric, and I'm telling you, madam, just look at the fabric once. Fabric is so beautiful. Fabric is having a print like this. So you will say, wow, this is a beautiful print on this, okay. So what more you have, okay. So these are the things, the shopkeeper, they keep on telling you. So Fabry is just like fabrics, and this fabric is going to have what? They will have the Maltese cross which is there, okay. So these are just the Maltese cross which are actually there on that fabric. And sometimes you must have seen, if the fabric is not good, that leads to keratosis, okay, angiokeratosis, allergy that's going to happen. So Fabry's disease is actually angiokeratosis or angiokeratoma for that matter, okay. Kerato means skin, angio means blood vessels. So there will be little angiokeratomas which are going to be there. Can you see here? Yeah. So these are little eruptions, angiokeratoma. And of course some fibers, some fabrics, they don't let you sweat properly, so there will be hypohidrosis, and of course that leads to a lot of irritation. That means there is a peripheral neuropathy also. So peripheral neuropathy, hypohidrosis and angiokeratoma, these are the early features. Now what are the late features? The kidney disease, the heart disease, okay. I have seen in my home, my mother, my sister, they are fond of taking new fabrics every day. We don't have clothes, our cupboard is empty. Why? Because in Hindi we say dil to bachcha hai ji, okay. So dil means heart, cardiovascular. So their heart is just like a kid, okay. So cardiovascular and kid, all right. And the heart is just like kid. So kids are in a habit of demanding more and more. So they demand more fabrics. So late presentation is when heart and kidney both are affected, and of course the fabric is the disease, name of the disease which I have told you. That's why the name of the enzymes are also like this, like Fabrazymes. So fabric, all right. Fabry's disease, Fabrazyme, okay. And this you have to remember. Of course there is a deficiency of alpha galactosidase, so the name of enzyme is alpha, that is A, galactose means GAL. So agalsidase, that's the going to be the enzyme replacement, all right. Coming on to the Krabbe's disease, okay. Coming on to which disease? That's the Krabbe's disease. So what is Krabbe's disease? So Krabbe's, if you have to remember, just remember, like crabs are not seen nowadays. They are not seen nowadays. So they are delayed, they are extinct actually, okay. They are not seen nowadays, so they are extinct, they are delayed, like that you can remember. So why I am telling you this? Because in Krabbe's disease there is a developmental delay that's going to happen okay, in Krabbe's disease. Then what more is going to happen? There will be atrophy of cranial nerve number 2. So extinct means, of course, there is atrophy of what? Atrophy of cranial nerve number 2, that's going to be there. And simultaneously you can remember that the oligodendrocytes are also destroyed. oligodendrocytes are also destroyed, right? So all of this comes under the neuropathy only. So yes, can you see there is no proper, if you just, okay, I'll zoom in a little bit further. So can you see there is no second optic nerve which is there, which is shown properly. So that's why this is actually important for you to understand that optic nerve number 2 is involved in what? In Krabbe's disease, just like crabs are extinct. Coming on to Niemann-Pick's disease. So Niemann-Pick, okay, so Niemann-Pick has to pick something. So what is going to pick? Pick the cherry red spots. Pick what? Pick the cherry red spot. But remember, how will you differentiate? This is not a tiny organ, this is a big organ wala disease. This is a disease with a big organ. So they will have what? They will have hepatosplenomegaly also. So understand this, they have got hepatosplenomegaly, they have got cherry red spots on the macula, right? And one more thing which is important is they have got form cells. So Niemann-Pick has got what? They have got formy cells, of course lipid-laden macrophages. So these are just the formy cells, and this is the cherry red spot which is going to be there. This is actually important, Niemann-Pick disease. Then coming on to the metachromatic leukodystrophy. So for metachromatic leukodystrophy, please understand there is a leukodystrophy. So there is a leuco means white substance like myelin. So demyelination is going to be there, and because there is demyelination, there is neurodegeneration that causes ataxia and that causes dementia also. Okay, ataxia and dementia also. Okay, so yes, can you see here there is demyelination, there is less whitening, which you can see less whitening is there, and because of the less whitening there is more dark areas because white thing, that is the myelin, is not there. So there is demyelination which has occurred in this disease. Now very important thing whenever it comes in exam, so there is something, okay, I'll make the triad. So there is something, a disease which is called as normal pressure hydrocephalus. See, normal pressure hydrocephalus is actually a domain of pediatric faculty. What I can tell you, there is hydrocephalus, but the pressure is normal, intracranial pressure is normal. Why I am telling you here? Because the clinical features are global, okay, the clinical features are global ataxia, urinary incontinence, and dementia. Okay, so global ataxia, urinary incontinence and dementia, this is going to occur. Okay, now these three words, this is G, this is U, this is D, so this is G, U and D coming all together. So please understand, my dear friends, this GUD is good. Okay, so this is the mnemonic to understand the features of normal pressure hydrocephalus. Okay, so normal pressure hydrocephalus has got three features: global ataxia, ataxia means disbalance; dementia, that means the people are not able to recall the things properly, memory loss, something like that; urinary incontinence, that means the urination is not proper, there is incontinence, right? So why I have told you all these three things? Because the features of metachromatic leukodystrophy are very same, my dear friends. Can you see, there is ataxia, there is dementia. So ataxia and dementia are common between the two. If you have urinary problems, then the diagnosis will be normal pressure hydrocephalus, but if there is no urinary problem, the problem is going to be metachromatic leukodystrophy. So remember this, okay, just the urination thing can make a lot of difference. So this is a differential diagnosis. Okay, this this normal pressure hydrocephalus is a differential diagnosis for your metachromatic leukodystrophy. All right, yeah, so this is it about the diseases of lipidoses. I hope that all the sphingolipids are clear to you and all the concepts are better retained in your brains. Thank you so much for watching. God bless you.